Hey folks, Dr. Joe Esposito here. I'm glad you're there because today we're going to talk about something near and dear to my heart, a little play on words there. Unexpected signs that you're at risk of a heart attack. Now, all of us, I'm going to assume, have been affected by heart disease one way or another. Certainly if you're old enough, you've had a friend, a family member, a loved one pass away or certainly have a heart attack. And there are certain signs and symptoms that the body sends to you many times before the heart attack. Now, depending on the study you read, 35, 45% of all heart attacks, the first symptom is death. Hard to fix that one. But oftentimes when you dig deeper into the studies, you find that these people had some of the symptoms we're going to talk about today and didn't do anything about it because they didn't know it was related to a heart attack. And I say many times, don't be a taint nothing patient. Oh, I have pain in my neck. That taint nothing. No, it is something. And you got to worry about that. And so neck pain, back pain, shoulder pain, numbness, tingling, sciatica, these are all signs that there's something wrong. Don't ignore it. The signs we're going to talk about today are specifically for heart disease. How about toothaches? My dad had rheumatic fever as a child, and it wasn't taken care of properly. And the infection spread from his body into his heart, and as he got older, he got really weak and tired. I mean, to the point where he couldn't even move. So we finally took him to a medical doctor. I was a child at the time. And it turns out he had a weakened mitral valve, which is one of the valves in the heart. And it was from the rheumatic fever getting into his body, eating away at the infection, ate away at his valve. And so he had to have a valve replacement, did a wonderful job. He had a place called Deborah Hospital in New Jersey. And he lived many, many years after that. He did pass away eventually, but lived many, many years after that. Amazing medicine. Just medicine at its finest. I was a kid just being amazed at the work they were doing there. So it was great. But the same membrane that lines your gums and your teeth area also lines your heart. So if you have a tooth infection and a toothache, don't take that lightly. You want to get that checked and fixed as quickly as possible. Because if that infection gets into the lining of the heart, it can cause some real serious issues. So don't play around with toothaches. Don't think, it'll just go away. It's no big deal. It can be something really serious. And not saying it's a sign of a heart attack, but it could be something that can lead to heart problems. So get to your dentist. Don't come to me for that. I'm not a dentist. I'm very good at a lot of things. I'm not good at teeth. So you can go see your dentist and they can take care of that. That's really a dental issue. Now, in the healthcare world, the highest rated doctors, the ones with the highest success rate, are dentists. They get the best results rate because you have a cavity. They go in, they look at it, they fill it, you walk out, you're done. Chiropractic is the number 2 highest success rate among healthcare providers. And so that's why if you have health issues, back pain, neck pain, shoulder pain, I recommend you do consider chiropractic care because chiropractic is the most effective, least expensive treatment for back pain and certainly the highest results of back pain because dentists don't deal with back pain. So that's why it's really something you want to consider if you have an issue. Start out with the most effective, least expensive. Now, can't say chiropractors I'm a chiropractor. My colleagues can fix everything, but we're pretty darn good at it. So if you want to make an appointment, you go to our website, drjoe.com. We can do that for you. Other signs and symptoms you don't want to ignore. You cough up pink or white mucus. Now, normally mucus is clear. If you have an infection, it's yellow. But if you start coughing up pink mucus or white mucus, that could be a sign that the heart's not working properly. And the white or pink mucus could be a result of blood leaking into the lungs, and then you're coughing it up, and it's leaking because the heart isn't pumping strong enough to keep everything moving. Now, heart failure, which is a common diagnosis, does not mean your heart is going to fail. It just means it's not working as well as it should. Now, it simple means it's not going to pump the blood the way it should, and that's according to U.S. National Library of Medicine. If you have these issues, go see your medical doctor and let them check it out. Now, when it comes to mucus, the number 1 mucus-producing food there is dairy products. So something simple that you can do before getting all freaked out is cut out your dairy products. Stop eating all dairy and wheat. I'm going to add wheat to that too. So no wheat, no dairy products. If you produce a lot of mucus, I'm going to say do that for 2 weeks. Very simple. No wheat, no dairy, not a bite, not a nibble, nothing. At the end of 2 weeks, eat some wheat and dairy again. Maybe have a couple of slices of pizza. See how you feel. And if you start to see the mucus come back, you start to feel sluggish, start to feel bloated, gassy, then you know that you shouldn't be eating wheat and dairy. Now, the nice part about this experiment is I don't think you should be eating wheat and dairy. And so by doing it, inevitably, people come back and say, well, Dr. Joe, I felt so much better when I wasn't eating wheat and dairy. I got a message the other day from a chiropractor, somebody I went to school with years and years ago. And she said, love what you're doing, getting the word out, natural health, a leader in the healthcare field, really exciting. I listened to your show the other day and I gave up wheat and dairy for 2 weeks. I felt amazing. Thank you. So here's somebody I went to school with, same education I had, and yet somehow she didn't get that memo. And so if you do have a lot of mucus, give up the wheat and the dairy, 2 weeks, see what happens. I think you'll be very happy with the results. And then if it clears up, then you know it's wheat and dairy. You don't have to worry so much about the heart. If you have swollen extremities, it's called edema, that could be a signal that there's a cardiovascular issue. The hands and the feet being swollen for long periods of time is a sign that blood is not being pumped properly through the body. So when blood is not being pumped, it can collect in the places farthest away from the heart, which would be what? Hands and your feet. So if you find any part of your body is constantly, inexplicably swollen, you want to get it checked. Now, there's 2 types of swelling that I look for when patients come in. It's called pitting and non-pitting edema. Now, pitting edema is the one you have to worry about. So if you have swelling ankles, let's say, or anywhere, push on it, like you're pushing into Play-Doh. And if you push on it and your finger indent stays there, that's called pitting edema. You want to get a medical evaluation right away. If you push on it, bounces right back, it's a good idea to get it checked, but chances are it's not so serious. But if you push on something, especially the ankles, and it stays there, that's pitting edema, could be a sign of the heart failing, and you want to get that checked right away. Again, don't be a taint nothing patient. Taint nothing, don't worry about it, doc. I've had this for years. All the more reason to worry about it. You've had it for years. So these are just signs and symptoms you want to look for. We're talking today about signs and symptoms you don't want to ignore because it may be a heart issue. If you start losing the hair on your legs, this is an interesting statement. If you found that all the hair on your legs fell off pretty quickly, that could be a sign that the hair follicles are not getting the nutrients that are necessary for hair growth and through the blood. Of course, the blood isn't getting there. If the nutrients don't reach the hair follicles, they don't get enough oxygen, they're more likely to fall out. So in other words, sudden hair loss on your legs could be a sign of a heart problem because you're not pumping enough blood to the extremities. You'll notice this symptom in the lower legs first, since it's the farthest away from your heart. Now, a couple of things you got to be thoughtful about. If you wear dress socks, or any type of socks really, you'll find that the bottom part of your legs, for men, I know this because I wear dress socks every day, the hair starts to fall out. Why? Because the dress socks are rubbing against it and causing it to fall out. So if you have a delineation of hair loss right where your socks were, probably nothing to worry about. I remember I was probably in my 50s, I guess. And my mother said to me one day, I was wearing shorts one day, I went to go visit her, and she said, you still have a lot of hair on your legs. And I said, odd, but yes, I guess I do. And she said, that's a good sign, because if the testosterone levels drop too much, you lose the hair on your legs. Now, I knew this, but I was surprised my mother knew this. So if you're losing hair on your legs, it could be a heart issue, could also be a testosterone issue. Now, I'm going to go off topic for a second. Well, not really, because testosterone is important for the heart. Testosterone is a hormone. For men, it's produced in the testicles. The adrenal glands are a backup source. And it's good for muscle. It's good for sex drive, but not just your biceps and your triceps. How about your heart, which is a muscle? Your lungs, your liver, your spleen. My father had a prostate issue, and he had a weak heart. He had to have heart surgery, and he was doing okay. And they found a little swelling in his prostate, and the doctor said, we're going to give you a shot that's going to stop your testosterone production, because testosterone could cause the prostate to grow and become from benign to cancerous. So I wish they'd consulted with me. My parents, they didn't. And they went ahead and got the shot. Well, within days, all the hair fell out of my father's chest, fell off his arms, his legs, and he felt really weak. And you could see his muscles deteriorate very, very quickly because, again, he stopped producing testosterone. And then one day he was laying on the couch. My mother said she was in the kitchen. He went in the living room, laid on the couch. She heard him fall off the couch. She heard a thump. She thought he fell asleep and fell off the couch. And she went in and he was dead. And I looked at the drug that they injected into my father to lower his testosterone. And one of the warnings, the big warning, big bold letters, do not give this drug to anyone who has a heart condition. I submit that drug killed my father. And I was mad. I'm still mad. But it's important that you don't mess with testosterone because it affects your heart. Now, there's a couple of things you can do. Number one is you can take testosterone. And if you do, you'll be amazed how good you feel. You'll have lots of energy. Sex drive will pop right back usually. Muscles start to feel good. You work out. You start building muscle real fast. The problem is when you start taking testosterone, your body says, oh, I have plenty of testosterone. I don't have to make it anymore. So your body tells the, the testicles and the adrenal glands, all right, shut down production. We got too much testosterone right now. And it's really hard to jumpstart them to get them work again by themselves. So once you start, many times you have to keep taking it forever. I don't like that because your testicles can shrink, sex drive can shrink, your sex organs can shrink, and maybe you have good muscle mass and you look good, but things don't work. So what I like to look at with a patient, especially as men get older, is are they producing testosterone and is it converting into estrogen? Now, this might get a little complicated for you here, so bear with me. Testosterone, the way we make estrogen, men, is we convert testosterone into estrogen. And there's an enzyme that does that called aromatase. So aromatase gets the testosterone, converts it into estrogen. If you're producing too much aromatase, you may be producing plenty of testosterone. It's just being converted over. So a couple of things you can do that's a little, I feel, a better approach, more natural, is you can do things called aromatase inhibitors. Aromatase inhibitors, you can take it as a drug. They give it many times to women with breast cancer because some breast cancers are stimulated to grow by estrogen. So they don't want you to have estrogen in your life. So they'll give you a aromatase inhibitor to stop women's estrogen from converting testosterone from converting into estrogen. For men, it's a real simple thing. We can eat more cruciferous vegetables. That would be broccoli, cauliflower, kale, Brussels sprouts. You can take it as a supplement. We put cruciferous vegetables in our Dr. Joe's Essential Source. One of the reasons I put powdered cruciferous vegetables in there is because it acts as an aromatase inhibitor for both men and women. So you can take extra supplements if you need to. There's also something called stinging nettle is the supplement. It has something called quercetin in it. And quercetin, it's also found in apples and onions, can also act as an aromatase inhibitor. So once again, when we start looking at the natural way to treat things, everything seems to go back to fruits, vegetables, nuts, and seeds. Nowhere do we talk about taking alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. We seem to keep veering off toward the fruit and vegetable world. Stinging nettle is an herb. Quercetin is a component of the herbs. Apples, onions, of course, Dr. Joe's Essential Source. I'm not saying this is a cure for anything, but this is something that I take every single day because I had my testosterone checked and I'd had my estrogen level checked and I had more estrogen than I should have. Well, the reason that happens is I was converting my testosterone into estrogen, so I started to take natural aromatase inhibitors, which is fruits and cruciferous vegetables and stinging nettle. So the reason this ties into the heart story is that testosterone is really important for heart function. But the thing that gets me, and I'll go off on a tangent now, is women with breast cancer, my sister died of breast cancer, is they'll say, we're going to give you an aromatase inhibitor because you have the type of cancer that is stimulated by estrogen. We're going to prevent your testosterone from converting into estrogen, so lower your estrogen levels. But they never say, cut out the dairy products. Well, I can't say never. I'm sure some doctors do. Dairy products loaded with estrogen. Commercially grown animal products, meat, eggs, many times are injected with growth hormones, and the animals are very high in estrogen because estrogen causes you to grow, and the animal's fatter, and we sell animals by the pound. They don't talk about environmental toxins, hairsprays that have perfumes in them, colognes, perfumes, shampoos that are fragrance, cleaning products, air fresheners for your room. Many of these chemicals have endocrine disruptors, which act like estrogen. So when it comes to lower your estrogen, boys and girls, it's a good idea to look at it from every angle. What did Joni Mitchell say? I looked at life from both sides now. I want you to look at it from all angles now. And look at that. If you wear perfume, if you wear cologne, if you wear scented deodorants or shampoos that have fragrances in them, stop that. Unless it's a natural essential oil, chances are it's a phthalate or a chemical that's going to act as an estrogen stimulator. We don't want more estrogen. We want less estrogen as we get older. When you're younger, it's important. As you get older, you want it less. So got off on a tangent there, but it personally affected me. When they gave my father that shot that knocked out his testosterone, that I'm going to guess made his heart stop. I'm assuming it killed him, because it says can lead to death if you have heart disease, and he died of a heart attack. But also just for you generally. I want you to think about what you're doing every day. I had a patient come in the other day, liver cancer, and it was bad, and she was morbidly obese, and she had so much perfume on. And I said, one of the things you have to do is stop using the perfume, because perfume acts like an endocrine disruptor, messes with your hormones and estrogen. She said, but I like my perfume. And I didn't want to be smug, but I said, but you don't like your cancer, right? She said, correct. I said, I'm not saying this is causing the cancer or even going to make it worse, but why not take that action step? Why not be safe and cut out your fragrances and colognes and carpet cleaners and new car smells? If I get my car washed, I always say, you want to spray, what kind of car fragrance you want? None. I don't like fragrances. I don't like patients wearing fragrances. I don't like being around fragrances. So cut it out. Now, essential oils would be okay, but don't fall for the thing that says made with essential oils as opposed to essential oil. Made with essential oil means it has other chemicals as well. Pure essential oil is different. So I digress, but please stay away from these things if you're looking out to keep your heart healthy, because you need to. Other signs and symptoms that you may have heart problems. Your toenails turn purple. I had a patient call in one of my shows the other day, and she said her grandson's fingernails are white. And I said, when you push on his fingernail and let go, it stays white? She said, yes. I said, it's not pink at all. She said, no. I said, get him to the pediatrician. That can be a sign of anemia, not getting enough oxygen, not enough iron in the blood, not getting enough oxygen. Could be weak heart. The heart's not pumping enough blood. So your fingernail beds are a good indicator. If you squeeze your fingernail bed and then let go of it, it should turn pink pretty quickly. It'll turn white when you squeeze it, turn pink right away. That's a sign of good circulation. Same thing with your toenails. If your toenails are purple, now unless, of course, you stubbed your toe or something like that, if they're purple or blue, it could mean that your extremities are not receiving enough oxygen. And it's probably due to clogged blood vessels, which indicate the disrupted circulation. And if it's left unattended, it can become a real serious issue. Now, the other thing I find with circulation, and that doesn't seem to be discussed, and I wish it would, is that you can have pinched nerves that can affect circulation. So, for example, the nerves in your low back. The nerves in the low back control everything from the waist down. Back pain, leg pain, hip pain, knee pain, ankle pain, numbness, tingling, circulation. So I've had people come in and say, Dr. Joe, I've been to the cardiologist. I've been to the vascular doctor. They checked me out. My circulation is fine, according to the test, but I still have cold feet all the time. Well, we checked the nerves in the low back. That could be a problem. And that's where chiropractic comes in. This is where chiropractic fits into every aspect of healthcare. I can't imagine why it's not incorporated everywhere. Had a doctor call me the other day, and he says, Doc, I work for a hospital here in Atlanta, and I have a chiropractor. I work at the hospital. I didn't know they had that. And he says, I can't thank you enough for everything that you're doing for putting chiropractic into the forefront of healthcare. And I said, well, you're welcome. He says, no, you don't get it, Doc. Every day, doctors in the hospital, nurses in the hospital, patients in the hospital, I don't think a day goes by where people aren't talking about you and everything you're doing. Doctors love you. Hospitals love you because you're telling people what to do. Makes their job easier. So if you have pain, neck pain, back pain, shoulder pain, I'm going to suggest that you come see us or a chiropractor to see if it's a pinched nerve. Chiropractic is the most effective, least expensive treatment for back pain. Why you're not coming to see us, I don't know. So if you have health problems, neck pain, back pain, shoulder pain, we're good at digestive issues too. Nutrition, certainly, we're stellar at. Go to our website, drjoe.com. You can book an appointment right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can get you an appointment usually within 24 hours in one of our offices. We accept almost every insurance out there. The initial visit is normally $712. For our listeners, my listeners, we've reduced that to $299. That's exam, x-rays, consultation, first treatment, going over the x-rays on your follow-up visit, and a complete nutrition evaluation. The x-rays alone anywhere else are probably going to cost you more than $299. We do this because we want to find out if you're a chiropractic candidate. And if you are, then we'll put together a treatment plan for you. And then we'll talk about insurances and treatments and everything. But make an appointment right now. Stop wasting time. Don't be like so many patients that say, Dr. Joe, why'd I wait so long? I wish I'd done this sooner. I don't know. We get patients from all over the world come to see us. So if you're in the Atlanta area, we would love the opportunity for you to become one of our patients. drjoe.com. You can book it right online or call us, and we're happy to give you more information. If you have any questions, you can always send them to me through the website, drjoe.com. There's a little bot that pops up and says, hey, want to chat? Say yes, type in your question, and then me or my assistant, Joe, will answer your question for you. And we also have supplements as well. One of the things I talk about a lot when it comes to circulation is a supplement called nitric oxide. Nitric oxide opens up your blood vessels and increases circulation. So patients with kidney issues, patients with brain issues, patients with sexual issues, or just patients in general who want to feel better and have more energy, I'm a huge fan of nitric oxide. I take it every day. It gives me tons of energy, keeps my brain working well, keeps everything working very, very well. So I can't imagine why you would. The only reason you wouldn't take it, there's no reason I wouldn't imagine it, is if you have low blood pressure. If you have low blood pressure, it can lower your blood pressure even more. But if you have high blood pressure, monitor your blood pressure, because if you're on medication, it might actually make your blood pressure too low. And then you got to decide, talk to your medical doctor, give up your medicine or give up your nitric oxide. I kind of know where you're going to go with that decision. And then the minimum supplements I think everybody should be taking every day as a prophylactic measure are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. There's 3 different types of Essential Source. 3 different types of Super Greens. I'm sorry, plain, mint, and hemp. Nutritionally, they're all about the same. They just have slightly different flavors. But I can't imagine not taking Super Greens, Essential Source, and nitric oxide first thing in the morning. Now, I take other supplements too. I take omega-3 for my brain. I take vitamin D, which I think should be the law. Everyone should get their vitamin D levels up to about 60 to 80 nanograms per milliliter. I think we'd avoid a lot of health issues if we did. I take adrenal support. I take men's hormone support. So I take supplements that I've put together for myself. But the minimum, I'd say, starting for you would be Super Greens Essential Source. And if you don't have low blood pressure, you can try the nitric oxide. Any questions you have, though, again, that's a general recommendation. If you have other questions, send them to me through the website, drjoe.com. I'm happy to answer your questions. We're talking today about signs and symptoms that could mean you have a heart condition. By the way, if you like what you're hearing, you can go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And on your podcast service, we have hundreds of hours of podcasts, maybe thousands now. And on our website, drjoe.com, we have over 3,000 hours of podcasts, audio and video. So all the information's here for you folks. Just type in the search bar what you're looking for. Chances are we've got it. And if you're a social media follower, please follow us on social media at Dr. Joe Esposito, Facebook, Instagram, YouTube. We have a great YouTube channel at Dr. Joe Esposito. Other things that could be signs and symptoms that you have a heart issue. You can't catch your breath. I remember when my dad, his heart finally started to fail. I came home one day and he couldn't get off the couch. He couldn't breathe. And he wasn't exercising or anything. So if you get winded very quickly, even if you're not working out, just walking up the stairs, it becomes difficult to breathe. That can be a sign or symptom of a heart problem. Now, people may think they're just out of shape and they run off to the gym, which could actually make it worse because you're working out harder. But simple things like getting up, walking up the stairs, if you're winded, you might want to get to your medical doctor and get that heart checked. Now, folks, got to go to break. If you have any questions, drjoe.com, send it to me through the website. We'd love to see you as a patient. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Stop suffering. And bring your kids, too, by the way, because kids have spines, and they need to get their spine healthy. Because if they start out healthy and straight in their spine, they usually grow up healthy. So it's a great opportunity for the whole family to get on the website, drjoe.com. Hey, folks, Dr. Joe Esposito here. Glad you're with us. Hey, listen, what we're talking about today is signs and symptoms that you might have a heart condition, or multiple heart conditions. And you don't want to ignore these. And I say this a lot, don't be a taint nothing patient. And what I mean by that is, it taint nothing, doc. I'm just old and I can't walk upstairs like I used to. Well, yeah, that's an issue. But if you're so winded that you have to stop after a few steps, that could be a sign of a heart condition. Your toenails are purple. We talked about that earlier. Your hair falls off your legs because you may not be getting proper circulation. It could be other things too, but I always want to err on the side of caution. Okay, I had a mole on my skin. Had it for years. And a gal I knew, she said, you need to go get that checked. And I said, okay. So I went and got it checked. Doctor says, totally benign. Don't worry about it. Now, I could have been a taint nothing person and said, it's no big deal. Don't worry about it. And maybe it was skin cancer. Well, wasn't. Okay. But I'd rather you spend a couple of bucks, get your body checked. I always say that with your spine. I can't imagine why it's not the law that everybody has to get their spine checked, because the nervous system controls everything, and the spinal column protects the spinal cord, and the spinal cord is the nervous system. So I can't imagine why we don't, force people to get that checked. We force them to do other things that I don't think are necessary, but we can certainly, it's important to get that spine checked. So it's a good idea to get these things checked as quickly as you can, because we don't want them to become something serious later on in life. So if you do want to get your spine checked, we'd love to see you as a patient, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. Other things that can be signs and symptoms of a heart condition, and again, it doesn't have to be, but it may be, you can't exercise as hard as you used to. Now, we're all getting older. I certainly can't do the things I did when I played football and hockey in high school, but yeah, we are getting older. But if you get really fatigued really fast, it kind of goes with that can't catch your breath thing, go get it checked. I want to be wrong. I love it when a patient comes in our offices and we do a spinal evaluation, maybe do some blood work on them, or we do some testing for allergies, and the tests come back negative. I love that. I remember being a kid, and we lived on Willow Avenue in Hoboken. We walked around the corner to Dr. Waltman's office. I can still picture exactly what it looks like. I could smell it. And he delivered me and my sister, and he was our doctor. And my mother took me there one day. I guess I had a cold or something. And we left, and she was angry. And she was angry because he didn't give her a prescription. I think the visit was $5 at the time. And she says, we just spent $5, and he didn't even give us a prescription. Now, looking back, I thought Dr. Waltman was a genius. You don't need drugs. It's okay. The kid's got a cold. Relax. He's going to be fine. Now, if it became a big issue, of course, you should get it checked. But I remember that. And I remember walking home. I can picture holding my mother's hand, walking down, was it Clinton Street? 8th Avenue? 8th Street? Whatever it was. And I just remember that. So, yeah, there are some times we don't need a lot of drugs, but I'd rather go to the doctor and find out that there's nothing wrong, like we do with outpatients, and say, hey, listen, you just spent some money and there's nothing wrong, than finding out there is something wrong. But you don't know that because you didn't get it checked until late. So the sooner you get to anything, neck pain, back pain, shoulder pain, if you're having a car accident, please come see us right away. Please don't waste time. I cannot stress that enough to you, because the longer you wait, the insurance companies jerk you around. The other witnesses may disappear if it's not your fault. Even if it is your fault, come see us. So, yeah, you want to get treated right away. But heart disease, diabetes, cancer, the quicker we get to it, the better off we're going to be. It's much easier to deal with. So come see us. Get these things checked, as we're talking about. If you have uncontrollable nausea and vomiting, now this is kind of an odd one, because the bottom lining of the heart that surrounds the structures of the stomach is inflamed. So the heart and the stomach are kind of right near each other. And it can, again, the stomach's below the diaphragm, the stomach's above the diaphragm, but it can kind of push through there and start to irritate the stomach, and that can cause feelings of nausea, abdominal pain, even vomiting. Now, we all get sick every now and then. It's no big deal. But if this is an ongoing situation, it could be a heart issue. Most likely, it's not a heart issue. It's probably your stomach pushing up into your diaphragm. And when the stomach pushes up into the diaphragm, you might have nausea, vomiting, acid reflux, heartburn, burping, gas, bloating. It's the number 2 reason the doctors in my clinics see patients. The number 1 reason is pain, neck pain, back pain, shoulder pain. Again, we're a chiropractic pain management clinic. We're really good at it. But if you have digestive issues, which is the number 2 reason we see patients, you might want to come see us and let us check that. Because many times the stomach is slammed up against the diaphragm, and we can actually physically massage it or pull it down away from the diaphragm. We call it an adjustment, but it's more like a massage. And let me tell you, if you have this condition and my doctors can fix it for you, you want to name your kids after them, because it's amazing when the digestive system starts to work, because the brain and the digestive system are connected by something called the vagus nerve. And so if there's a digestive problem, there's going to be a brain problem, always. And so when you say, well, I don't have any brain problems, doc, but I got terrible gas and bloating and diarrhea. Yeah, your brain is not capable of working if it can't absorb nutrients, if it can't pass out waste products, and if it doesn't have a good connection between the stomach, the digestive system, and the brain. So you might want to come see us if you have that, And in many cases, it's not one and done, but in many cases, it takes a few visits, but you're very happy with the results. The reason I say that is I have this condition. And when I was a kid, one of the earliest memories I have of laying in my bed in Hoboken, New Jersey on Willow Avenue is my heart just racing out of control and then stopping and then starting again and then fluttering. And I just thought it was normal. I was a kid. I thought that, I don't know, I guess this is what hearts do. You know, there was a song, Hearts Can Be That Way. Who was it? The guy from Jefferson Airplane. Can't think of it. So I digress. Marty Ballin did it. Hearts was the name of the song. But hearts can be that way, I thought. And I thought, well, okay, that's just how my heart is. And then years later, when I became a doctor and I was seeing patients, and I saw a lot of patients with this, I realized that's what I have. My heart would beat and then stop and then start and then flutter. And when I finally got my stomach adjusted and fixed, my heart fluttering and my heart irregularity went away. Now, I'm not saying that's the only cause of heart afibrillation. It's called AFib. It's not the only cause, but in many cases, that's the cause. And if we pull the stomach away from the diaphragm, it takes the stress off the vagus nerve, which many times sends a very relaxing message to the heart, and blood pressure can come down. We have had countless patients over the years with acid reflux and heartburn and high blood pressure. Fixing the acid reflux and the heartburn, the blood pressure got better. So many, many important connections between the digestive system, the heart, the brain, and I find just treating one of them doesn't work. You got to treat all of them. So that can cause nausea, vomiting, but it could be the heart inflamed causing the nausea and vomiting feeling as well. So we look for other symptoms to go along with it. And my team of doctors were like investigators. We're detectives. Okay, you have this, and this. Okay, so what might it be? And then in my mind, I have a flow chart appear. And it says, okay, if it's this and this, then let's go here. If it's this and this, let's go look at acid reflux. Let's look at pinched nerves. Let's look at diet. Let's look at the cervical spine. That's the nerve supply that the brain stem comes down into the cervical spine. Maybe it's stress on the cervical spine causing dizziness. So I always, it's weird. I see this flow chart in my head and I want to go, okay, what direction are we going to go in with this? Now, understand something when you go to a doctor, any doctor. Doesn't matter, me, medical doctor, orthopedist, neurologist, neurosurgeon, psychologist, psychiatrist. When you come in, we do something called a working diagnosis. So we come up with what we think it is. Then we do tests, then we do treatment, and then we reevaluate and say, okay, was my working diagnosis right or not? Maybe it wasn't. Maybe you needed a pain management doctor. Maybe you need some injections. Maybe you need an MRI. Maybe you need a CAT scan. Maybe you need an oncologist. Maybe you need a cardiologist. So patients many times go to doctors. I went there once and they didn't fix me. Doesn't matter what kind of doctor. And I always play the devil's advocate and I say, well, you know what? Maybe it's going to take more than one visit. You know, I went to the physical therapist and my back still hurts. Well, it may take more than one to build up those muscles. It may take more than one adjustment to fix it. Maybe you're sore after getting adjustment or going to the physical therapist. That doesn't mean it didn't work. My mother, I went to the doctor and Dr. Waltman didn't give me a prescription. That means it did work. Let the kid heal. Don't need more antibiotics in your body. So understand that when you go to a doctor, don't be too flustered because it's always a working diagnosis that we start with. We have no other choice to see if we're right or not. So if you have nausea, vomiting, uncontrollable, again, could be a heart condition, could be other things. Another sign, and you hear these commercials all the time on the radio, is you're having trouble in the bedroom. And that's for men and women. Now, it's entirely possible that things like erectile dysfunction are simply a sign of stress, of aging. Many times it's a pinched nerve. Men come to us all the time with low back pain, and then after a few visits, they'll say, oh, by the way, doc, I also have ED. And I'll say, this is the nerve to the sex organs and the colon and the bladder. And then after several treatments, they come back and say, doc, it's working. Good job. So ED, erectile dysfunction, or women too, same thing, you need nerve and blood supply to the sex organs, could be a sign of pinched nerves. Could be a sign of circulation, could be a sign of clogged arteries. It could be aging, could be stress, but it could be a sign of circulation as well. And so that's why we look at our patients and we say, okay, what do we need to do? What direction do we need to go in to get this person better? And we look at all options. We use something called acoustic wave therapy, and we use that for joints. We use it for the wrist, the shoulder, the hand. And it sends sound waves, essentially like thumping, thunk, 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 sound waves into a joint. It can break up scar tissue. It can increase circulation to the joint. It can stimulate stem cell growth into the joint. So the stem cells are the stems that grow new tissue. And if we use it for things like erectile dysfunction, it can help grow new blood vessels for men and women. So that's something to consider as well, a natural approach. So we want to look at things like nerve supply, diet, things like nitric oxide as a supplement, supergreen's an essential source to give you nutrients. We might consider acoustic wave therapy as an option. You can always go to things like PRP injections. So there's a lot of different things we can do naturally because, again, just like taking testosterone, it might work short term, but long term, there can be side effects. And then we have to look at those side effects and is it worth it? Whenever we do a treatment, anybody in a healthcare profession, we always think the same thing. Is the treatment worth it? And if the answer is no, you shouldn't be doing that treatment. It's very simple. If the answer is yes, then you should go ahead and do the treatment, in my opinion. But anyway, problems in the bedroom could be signs of decreased blood flow, and this could be a symptom that your doctor wants to check out for your heart, see if the heart needs attention as well. You sweat excessively. Now, some people have something called hyperhidrosis, and they sweat a lot. And many times that's due to irritation of something called the sympathetic chain ganglion. Down the middle of your back, starting kind of at the base of your neck all the way down to, right middle of the back, above the low back, sort of. There's something called the sympathetic chain ganglion. These are nerves, and they're way stations. Nerves go into this chain ganglion, and then they send nerves elsewhere. Don't worry about that. But the sympathetic chain ganglion, if they're being irritated, cause you to be into what's called sympathetic mode. Now, there's two types of nerves in the body, real simply put. There's sympathetic nerves, which speed you up, and parasympathetic nerves that slow you down. If the sympathetic chain ganglion are being irritated, you're stuck in the sympathetic mode. You're kind of in speed up mode, and that can cause hyperhidrosis or excessive sweating. So you can do things like take out the sweat glands. There's surgeries you can do, but it doesn't treat the cause. It treats the symptom. So excessive sweating could be a sign of a heart attack or heart failure. It could be a sign of irritation of the sympathetic chain ganglion. So don't think just because you sweat a lot, it's a hospital issue, an emergency issue. You might want to come see us. Let us check the mid-back to see if you have any pinched nerves near the sympathetic chain ganglion, and let's see if we can put those back in place. So that's another option as well. So once again, you may have these symptoms. It doesn't mean it's a heart condition. It just means that it could be a heart condition. And the reason I'm so passionate about this is I lost my father to a heart attack, and I think he didn't have to die from it. And that's my concern. If you have open sores on your legs or your feet, could be a sign of diabetes, could be a sign of circulation as well. So something to consider as well is if you have that, a blockage of the aorta, blockage of the common iliac arteries. If you have sores that don't heal, you definitely want to get that checked by a medical professional. Okay, we can, if you have issues, diabetes, circulatory issues, I'm happy to work with you chiropractically and nutritionally, but we want to co-manage that case with your cardiologist or your vascular surgeon to work together to keep you alive, of course, but also get to the cause of the problem and not just treat the symptoms. And that's what people love about chiropractic care, and they have for well over 100 years now, is that neck pain, back pain, shoulder pain, we try to fix the cause and not just cover it up. Sometimes you need drugs, sometimes you need surgery, but many times we're able to fix it without drugs and surgery. So just things to consider. And we'd love to be your doctors. If you'd like to make an appointment, we have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. We can usually get you an appointment within 24 hours if necessary in one of our offices. And initially, the first visit is $712. We've reduced that for my listeners to $299. That's you and anybody you refer to our office. Exam, x-rays, consultation, first treatment, going over the x-rays, complete nutrition evaluation. It's a very serious first visit and half of the second visit. And then if we do find something we think you need to treat, we'll put together a treatment plan for you. We accept everybody, whatever insurance, cash. We have cash plans available, payment plans available, no interest. We go through a company called Care Credit. So, yeah, we're happy to do whatever we can for you. So if you'd like to make an appointment, please do that now. Stop suffering needlessly. And it's not just pain we're dealing with. We're talking about organs and nerves that can be affected. The longer you wait, the harder it is to fix. Just go to our website, drjoe.com, and we'd love to set you up an appointment as quickly as possible. Other signs and symptoms that you may be having a heart issue is you have pain in your jaw. Now, it could be a manifestation of a heart attack or a cardiac event if you feel pain in your jaw, your teeth, your neck. Doesn't necessarily have to just be on the left side because that's where your heart is. But many times, jaw issues are the TMJ, the temporomandibular joint, comes out of place. Just like the bones in your spine come out of place, just like your bones in your hands, your wrists, your feet. Bone moves out of place in the jaw, the temporomandibular joint. There's a lot of nerve endings in there, and it can hurt. The more nerve endings you have, the more pain there's going to be. Now, the jaw, we have something called proprioceptive nerve endings in your jaw, highly concentrated proprioceptive nerve endings. And the reason they're there is so that you can talk and chew and swallow and not bite your tongue or bite your lips. So you have to know where you are in space. You know where your tongue is, you know where your cheeks are, and you can chew and you don't bite everything. And the proprioceptive nerves are the ones that tell you, hey, this is where you're supposed to be. It orientates you in your world. There's another set of proprioceptive nerves, highly concentrated, in your sacroiliac joint. That's your joint, your tailbone, down in that area. So many times when I have patients with TMJ problems, jaw problems, we try adjusting it. It may not work, working diagnosis. We then have to say what else can be affecting the jaw. It's the sacroiliac joint. So sometimes we have to adjust or set the sacroiliac joint back in place in order for the jaw to maintain its position. And I've had people wear jaw guards and night guards, and they stop wearing it, and the problem comes back. Then we go in, check the sacroiliac joint, stabilize that, the jaw holds its adjustment. So once again, my team of doctors and I, we're detectives. We dig as far as we can, as deep as we can, to try to find out where the problem's coming from, not just treating the symptoms. And many people wouldn't think to go to a chiropractor for jaw pain or sacroiliac pain or acid reflux. Well, that's why we do these shows. We want to let you know there are alternatives out there. And many of you, how many of you can raise your hand, how many of you have been to a doctor says, we can't figure out what's wrong, so there's nothing we can do, and they don't give you an alternative? Raise your hands. A lot of you do. There you go. My audience just raised their hand. So we see that all the time, and that's where my team of doctors come in. We try to do a little more investigation. Now, again, we can't promise results. We can't guarantee we're going to fix anybody, but in most cases, we get pretty darn good results. And the biggest problem we have, I'll be honest with you, just talk candidly, the biggest problem we have in our office is patients get out of pain so quickly that they discontinue their care. Now, it doesn't happen often. I feel better, doc. You fixed me. No, 10% of your nerves feel pain. 90% of your nerves don't feel pain. So you can have pinched nerves and not know it. So even if we get you out of pain, we still have to work to stabilize the spine. And that's where the biggest issue is. Well, doc, you fixed me. I'm out of pain. I came in for pain. Yeah, but the problem's going to come back because we didn't stabilize it. And then inevitably the problem comes back and they come crawling in. Oh, please take me back. And then we got to fill out new paperwork and you backslid in your treatment. So most treatments in our offices are about 6, 8, maybe 10 weeks total. Not every day. But most of the people, we can get their condition under control and stabilized within 6 weeks to 10 weeks, somewhere in there. Usually 6 weeks, to be honest with you. And then we can talk about a maintenance protocol. But when you come in, just do what we say. I always say, if I'm wrong, I'm wrong. So what? I'm wrong. I lied to you. But if I'm right, which I am, in most cases, you'll say, okay, now I get it. Don't try to, outjudge me. Don't try to out-opinion me on my team of doctors. We've been doing this for a long time. I've been in practice almost 38 years. I've missed a half a day of work in 38 years. I have all these degrees and certifications and awards, and so we're pretty good at what we do. And if my car's acting up, I bring it to a mechanic and I say, what do I need to do? I don't second guess him. Tell me what I need to do. I have my mechanic, Devin, and he's my guy, and he goes ahead and fixes everything for me, and I trust him. So I want you to consider that when you go to a doctor, that we probably know what we're doing. And that's why if you do want to make an appointment, drjoe.com, you can do it right online or call us. We accept people with all insurances, no insurances, cash injuries, car accidents, sports injuries. We want to do everything we can to get you well and keep you well. But you got to work with us. And it's very affordable. It's most effective, least expensive treatment. So drjoe.com. All right, other things that could be signs and symptoms of heart conditions is you start experiencing confusion. Now, have you felt off, kind of generally off? I don't know how else to put that. According to the American Heart Association, confusion, memory loss, impaired thinking could be due to changing levels of certain substance in the blood, such as sodium, and that could result in poor heart flow. It could be an adrenal gland problem. The adrenal glands produce adrenaline, which can help control blood pressure. It could be a nitric oxide problem. Nitric oxide opens up your blood vessels and allows the body to relax. Again, I talk about nitric oxide a lot. I love it. It's such a great supplement. It says on the bottle, it's Dr. Joe's nitric oxide. It says take 4 a day. What I recommend you do is take 1 to start early in the morning. See how you do. Take 2 the next day, 3 the next day, 4 the next day. And the reason is the first time I took it, I took 4, and I felt so hypercharged. I took it in the afternoon. I couldn't sleep. So I say, let's build up and see what level is good for you. I take between 2 and 4 a day. But if I have a stressful day, if I'm driving and I'm trying to stay awake, I have it in my car. I have a bottle. If I've just maybe did a lot of radio and television shows and I saw a ton of patients that day, many times I'll take an extra dose too. But nitric oxide is great unless you have low blood pressure. If you have low blood pressure, do not take the nitric oxide. Okay, I'm telling you not to take a supplement. But the minimum supplements everybody should be taking, I feel, every day would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I just mix them up with some coconut milk, almond milk. This morning, I put a half a frozen banana in there, whipped it up. It was amazing. And then I add my vitamin D. I add 5 drops of Dr. Joe's vitamin D as well to make sure my vitamin D levels are where they should be. And most people think that I'm about 15 years younger than I am. I like that. And people say to me all the time, how does your brain work the way it does, Dr. Joe? I keep my brain healthy. I'm not smarter than you. I just study a lot, and I keep my brain healthy, so I'm able to retain it. But most people my age can't do that. Other signs and symptoms that you might have a heart condition. Sleep apnea. Sleep apnea is when persistent sleep disorder that causes your breathing to stop and start throughout the night, and it prevents you from getting a good night's sleep. Mayo Clinic says it can lead to stroke, heart failure, high blood pressure. Many times sleep apnea is due to the stomach pushing up against the diaphragm. And if the stomach pushes up against the diaphragm can't drop down because the stomach is pushing up from the bottom, and you can't get enough air into your lungs. And so you're sleeping, you start to stop breathing, you're not getting enough air in the lungs, then your brain says, hey, wait a minute, I'm not getting enough oxygen, you better wake up and do something. And then you gasp for air, and then you wake up because you're not getting enough oxygen to the brain. The brain is trying to keep you alive. So I've had countless patients over the years with sleep apnea resolve the issue by us pulling their stomach down away from the diaphragm. We also want to check the nerve supply from the spine that goes to the heart and the diaphragm and the lungs and everything. So we want to get the nervous system working. You want to fix the digestive system if we can, physically or chemically. And then we want to make sure you're eating a good diet. That's the protocol we offer to every one of our patients. We see a lot of patients. Most patients are very happy with the care they get here. It's not a miracle cure. It's not going to happen in one visit. Don't lose your mind if it takes a few visits to get well. That's life. So if you'd like to make an appointment, drjoe.com. We would love to be your doctors. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can usually get you an appointment within 24 hours. If you want to do that, the first visit normally is $712. For our listeners, we've reduced that to $299. We accept people with all insurances, no insurances. Depends what your insurance covers. It's not us. It's what your insurance covers. If you're ever in a car accident, please, folks, if the car is damaged, please come see us immediately. If the car is damaged, you're damaged. Follow us on social media. At Dr. Joe Esposito is my handle. Facebook, Instagram, YouTube. We've got a great YouTube channel, folks. We post almost every week. And if you're a podcast junkie, type in Dr. Joe for the health of it. drjoe.com is our website.